Climate change, conflict, and disruptions caused by the COVID-19 pandemic have led to more outbreaks, more hunger, more need for help. In fact, now 339 million people face these threats, an increase of a quarter over 2022. Diseases like cholera, measles, malaria, Ebola, pneumonia are killers for the most vulnerable, especially those weakened by hunger. To face overwhelming threats, we need targeted solutions. The World Health Organization is on the ground in 155 countries, helping the most vulnerable people in the hardest to reach places. WHO is ever present, ever ready. We deliver science-based solutions rooted in the community to save lives and livelihoods. In 2023, we need $2.5 billion to answer the call of the most vulnerable. Through the Health Emergency Appeal, WHO will support more than 50 health crises worldwide. Every dollar invested in WHO generates at least $35 in return on investment. With increased funding and urgent action, we can save lives, support recovery, and ensure that communities are on a path to better health and better lives.
Good afternoon, Excellencies, distinguished guests, colleagues, and friends. My name is Fabia Lundquist. I'm working in the WHO External Relations Department, and I have the great pleasure in welcoming you to today's launch of the WHO Health Emergency Appeal. Without further ado, I now have the great pleasure in inviting the WHO Director General, Dr. Tedros Ghebreyesus, to provide opening remarks.
Thank you, Fabia. Your Excellency, Ali Haji Aden, Minister of Health of Somalia, Excellencies, dear colleagues and friends, good afternoon and thank you all for joining us, and especially thank you to His Excellency Minister Ali Haji for joining us in person here today. I would wish you a Happy New Year, but for a record number of people around the world, 339 million, it's not a Happy New Year. Instead of hope, the New Year brings fear. Fear of disease, fear of starvation, fear of conflict, fear of climate-related disasters that are driving people from their homes. As we enter 2023, we're witnessing an unprecedented convergence of crises that demands an unprecedented response. The number of people in need of humanitarian relief has increased by almost 25% compared with last year. The world faces multiple overlapping crises, and the most vulnerable are being hit the hardest. 80% of humanitarian needs globally are driven by conflict, and around half of preventable maternal and child deaths occur in fragile, conflict-affected, and vulnerable settings. The world cannot look away and hope these crises resolve themselves. That's why we're calling on our donors around the world to support WHO's health emergency appeal for $2.54 billion. These funds will support WHO's work around the world, responding to the urgent needs of the most vulnerable people in 54 ongoing emergencies, including 11 Grade 3 emergencies. With funding and urgent action, we can save lives, support recovery efforts, prevent the spread of disease within countries and across borders, and help give communities the opportunity to rebuild for the future. Last year, we launched our first consolidated health emergency appeal, and thanks to the generous support of donors, we were able to respond to many health emergencies. Outbreaks of Ebola in Uganda, cholera in 31 countries, and mpox around the world. Conflict in Ethiopia, Ukraine, Yemen, and elsewhere. Flooding in Pakistan, protracted crisis in the Greater Horn of Africa and the Sahel, and more. So this funding really makes a difference. It saves lives. At the Health Cluster Lead for Emergencies, WHO coordinates teams across health ministries, UN agencies, and over 1,600 partners. Communities and equitable access are the center of our work, and our on-the-ground presence in more than 150 countries allows us to respond quickly and efficiently when a crisis strikes. Our health and logistical operations help even the most isolated communities to get the rapid and predictable services and supplies they need. Health workers in Afghanistan, Ethiopia, Somalia, Ukraine, Yemen, and elsewhere rely on our support. We can only address these urgent needs by working together to help communities. We need to help them rebuild stronger, more resilient health systems. We need to support equitable access to medicines, vaccines, and other essential health products. And we need to forge the path towards a healthier, safer, and more sustainable world. I thank you.
Thank you very much, Dr. Tedros. May we now invite the Right Honourable Gordon Brown, WHO Ambassador for Global Health Financing and former Prime Minister of the United Kingdom. Mr. Brown, you have the floor.
In thanking the brilliant staff of the World Health Organization for the life-saving work day in and day out, not just over the COVID years, but every year, and in 150 countries, I want to especially acknowledge the outstanding and inspirational leadership of Dr. Tedros, who in this eloquent speech we have just heard today challenges us and the whole world to recognize that there are 54 chronic and severe health crises, 11 of them extreme, that the health emergency is not over, merely entering a new phase, and that we need an urgent infusion in excess of $2.5 billion if men, women, and children are not to die unnecessarily from avoidable illness and disease. Now, an unprecedented total of 339 million people are in need of urgent assistance across Afghanistan, Ukraine, South Sudan, Ethiopia, Yemen, DRC, the Horn of Africa, and more places where, as a result of war, plagues, famine, drought, or floods, specialized medical supplies and expertise are needed immediately if we are not to abandon the sick to disaster, disease, and death. Yet, notwithstanding these urgent medical needs and the WHO's absolute determination to carry out its duties as the health arm of humanitarian assistance, global health has received little more than 10% of humanitarian funding and just 5% of the amount deemed essential. And a study carried out by Affinity has shown that global support for health projects in low and lower middle income countries has fallen. Now, we know that to carry out its humanitarian obligations on top of all its other responsibilities in research, preventative health, the promotion of well-being, acute care, the sharing of information, the preparation for future pandemics, a total annual budget for the World Health Organization that amounts to just $7.5 per person in need of humanitarian assistance is simply not enough. And that is why today I appeal for the $2.5 billion that is needed urgently. Now, we say we value every human life equally, but if we fail to provide the WHO with the funding to vaccinate everyone equally, offer life-saving treatments equally, care for everyone equally, then that failure is a scar on our soul that will not fade. It's a wound that will not heal. It's a blight on humanity's common conscience that will not easily mend. And if we do not act, things will get worse. What we spend this year on conditions from malaria to measles, from diabetes to dysentery, from Ebola to epilepsy will determine who will live and who will die. And so it could not be any clearer that the budget is a moral statement reflecting the value we place on human lives. Now, when we think of climate change, we think of hurricanes, floods, droughts, firestorms, and melting ice caps. But we must now consider a far less visible but equally insidious killer force alongside war and conflict. And that's the unprecedented surge in the number of waterborne cholera outbreaks, now in 31 countries, and linked as are vector-borne diseases to climate. Now, in time, global health must enjoy sustained and sustainable finance with burden sharing based on countries' capacity to pay that avoids having to pass around the begging bowl from crisis to crisis. But today, I want to plead with donors to respond urgently to this emergency appeal to fund vaccines, drugs, treatments, equipment, and medical expertise. You know, hope dies when pharmacy shelves that should be stocked with drugs and treatments are bare, when doctors and nurses don't have the tools. Hope dies when they need to provide the most basic of care and cannot do so, and when vaccines that could save lives are hoarded in the rich north only to be destroyed as they pass their use-by dates. But hope comes alive if we can fund the medicines, provide the doctors, equip the health workers, avoid preventable deaths and suffering. So today I call on the governments listening to this conference today to fund this emergency appeal and support the WHO that is both the solutions and the means to deliver health to the most vulnerable. And in doing so, give hope a shot, inject optimism, inoculate us against more avoidable deaths. And let's remind ourselves that we are richer when we care for the poor, and we're more secure when we care for all those who today are insecure. Thank you.
Thank you very much indeed for this strong statement. Next, we'll hear from Ms. Sarah Charles, Assistant to the Administrator from the Bureau of Humanitarian Assistance of USAID. Ms. Charles, you have the floor.
Thank you for that rousing call, Right Honorable Mr. Brown, and to Dr. Tedros for welcoming us here today and for your leadership of the World Health Organization. Dr. Hassan, dear colleagues and honorable delegates, I'm so pleased to join you today. As we've heard, in 2023, we're once again facing a record number of people in need of humanitarian assistance globally, a staggering figure of 339 million people. And across the world, we're responding to the impacts of conflict, climate change, the still lingering COVID-19 pandemic. Millions of people are experiencing alarming levels of food insecurity and undernutrition, making them even more vulnerable to public health emergencies. Many populations lack sufficient access to health services, as we're seeing the concerning developments, such as the rise of cholera outbreaks and a drop in childhood vaccine coverage. The United States views health as a central component of humanitarian response. It's critical to saving lives and promoting well-being for affected populations. We welcome the launch of WHO's 2023 Health Emergency Appeal, which outlines plans for responding to health emergencies and delivering principled, need-based assistance in fragile, conflict-affected, and vulnerable contexts. We're proud of our ongoing partnership with WHO's Health Emergencies Program to expand and improve the quality of health emergency responses globally. This includes support for the Global Health Emergency Appeals. WHO's leadership in developing plans and appeals is critical to ensure the humanitarian health response is based on strong assessments and analysis, aligned with overall responses of governments and the humanitarian community, and communicated effectively to raise financial support necessary to meet needs. The United States is also proud to support WHO's Contingency Fund for Emergencies, which is facilitating rapid response to disease outbreaks and other health emergencies. This flexible, quick funding source helps save lives and mitigate the overall impacts of health emergencies. In the coming year, we look to WHO to be a catalyst for better quality responses to public health emergencies and stronger preparedness and readiness capacities. WHO's leadership and technical expertise is needed more than ever amid the complex challenges we face today, which adversely affect the health of millions of people globally. I want to reiterate our commitment to supporting WHO and its partners around the world as you work to deliver life-saving health services, medical commodities, support the global health workforce, and bolster national preparedness and response to public health emergencies. Thank you.
Thank you very much indeed, Ms. Charles. Our next speaker is Dr. Naram Hassan, an Iraqi doctor of gynecology who has been involved in the rights of women and minority groups for over 2 decades. Dr. Hassan is director of a hospital in Iraq, which is supported by WHO, and today she'll speak to us on behalf of healthcare professionals serving the vulnerable. It is our great pleasure to give you the floor, Dr. Hassan.
Thank you much for having me. Dear Dr. Tedros, dear colleagues, partners, and distinguished participants, I'm extremely privileged to have the chance to speak in this important event. I'm speaking as a health worker myself and on behalf of thousands of the health workers around the world who work under difficult conditions, day in and day out, to save the lives of the women, men, and children affected by the natural and man-made disasters and crises. I was told that the theme of this event is about serving the most vulnerable during crisis. And this is why I was encouraged to be the voice of the health worker who should never have to struggle just to do their job and provide direly needed services to their communities and communities they host, whether they are refugees, internally displaced persons, or just vulnerable people. I'm Dr. Naram Hassan, a Yazidi woman, a gynecologist originally from Bashiqa area in northwest Iraq, an area that you may recall from its struggle during ISIS invasion in Mosul and northwestern Iraq. When ISIS invaded Sinjar and other areas in Nineveh Governorate, millions of people fled their homes and sought refuge in Kurdistan region of Iraq and its outskirts, where I happen to be serving as a physician. Armed with my passion for humanity and my skills as a physician and my drive as a human being, I adopted the protection of Yazidi women and men as a personal cause and strive to heal both the physical and emotional wounds of the victim and survivor of this horrible war, where particularly women and girls paid the heaviest tribute. Amid the conflict, I, along with other dedicated and courageous doctors and nurses, managed to provide health care services under extraordinary circumstances. Kurds, Arabs, Yazidis, and Christians all needed access health services and must needed mental health and psychosocial support and a caring soul to heal their emotional distress. I was among the most fortunate. I was healthy, I had family, I had technical skills, and I had a job. And above all, my efforts to provide relief to my people were supported by health partners. Sheikh and General Hospital, where I work as a physician and as a director, was not far from the heavy clashes during the ISIS crisis. At this critical time, WHO provided technical and logistical support. We received medical kits that helped to save the lives of the victims. We also received extensive training on the best medical practices that helped some of who had not worked in a war environment before. Seeing WHO trucks loaded with medical supplies entering the front yard of hospital brought me a joy that I still cannot describe. As a doctor, I felt relieved and empowered to have the needed support to save the lives of my people. A feeling that nothing in the world can rival with. I'm truly grateful to the international community for supporting me and my community at that time we needed most. Recently, my hospital has again received support from WHO. We were able to open an intensive care unit and a cardiac resuscitation unit in the hospital, which has already saved the lives of the hundreds of the patients so far. Dear colleagues, ladies and gentlemen, today I thank you for support you have already given, but I also make a plea to continue to support health so that doctors and nurses and all many other healthcare professionals can carry out their duties in the best possible conditions and help the vulnerable people in need in Iraq and elsewhere. Thank you for your support. and continued commitment. Thank you so much for having me.
Thank you very much, Dr. Hassan, for these inspiring words and for all the work that you do. We shall now move to the room where I'm delighted to give the floor to Dr. Mike Ryan, the Executive Director of WHO's Emergencies Programme.
Thank you, and we've heard a lot of wonderful words. I'll try and keep mine as short as possible. Thank you, everyone, for joining us today. On behalf of those 339 million people that so desperately need our assistance and the assistance of so many of our partners. It's your presence here is a sign of a very strong partnership, a partnership for health, and for this I thank you all. As we launch the appeal, I think we have to reflect on the struggles that people everywhere are facing every day, and particularly those people living in the context of emergencies. This is so well represented by not only the challenges faced by Somalia, but the courage and innovation and ingenuity that the people of Somalia show in the face of those challenges. All around the world, and our colleague Professor Hassan said it, medical workers struggling in the front line, not knowing when the electricity is going to go out, not knowing where the next medical supplies are coming from. Many of us have worked in the front line of crisis, expect to rely on our skills. We expect to rely on what we've been taught and how we've been trained. But when you can't rely on the infrastructure, when you don't know where the drugs are coming from, when you have to look into the eyes of families and say you can't carry out that operation, you can't give a woman a safe delivery, you can't vaccinate the child, that's a very personal refusal. It's a very personal disappointment. You can write it in tables, you can put it on graphs, but it's a health worker that has to deliver that message every single day in cancelling life-saving interventions. So we owe it to them, and we owe it to the people they serve, to give them the tools, to give them the training, to give them the materials and the commodities to do their jobs. And in doing that, to protect their safety, to protect their lives. Because as we see, attacks on healthcare are growing. We saw the toll in COVID-19 of unprotected, untrained health workers having to work in the front line. So as Gordon Brown said, he talked about hope dies when that is not available. Hope dies in communities when there is no healthcare. But he also said to give hope a shot, because hope lives. Hope lives in places like Somalia. It lives in places like Somalia where there's innovation on the sustainable production of oxygen for the whole country, where there's innovation on field epidemiology training programs that's now going into the 4th cohort of training. There's innovation when countries like Somalia can leapfrog technology and apply PCR-based diagnostics in order to advance laboratory diagnostics. There's hope lives when trauma training is going on for surgeons in Somalia to deal with the deadliest of consequences of conflict. So hope lives. Hope lives where we put that hope. And I do think that those words resonate with us. There's a lot at stake. I would say, too, when we talk about the climate crisis and we talk about the fact that by 2030, if we don't keep temperature rise to less than 1.5 degrees, we're going to have a crisis. I'm sorry. The crisis is here. There is an ongoing, massive climate crisis affecting the lives of hundreds of millions of people. Livelihoods, land, and life is being lost in the millions, and we need to recognise that. And the funds we have out there that we assign for climate mitigation and climate adaptation must be applied now. The emergency is here, and we must trigger the release of adequate funds for countries that are suffering in this front line. And finally, I would say that from our perspective as WHO, we only work successfully when we work with countries and we work with our partners. I'd like to recognise the contribution of the more than 900 partners in the Global Health Cluster, those on the ground local NGOs who support communities, because at the end of the day, it is communities that go into crisis and it is communities that emerge from crisis, and it's communities very often who get themselves out of those crises with our help and our assistance. So localization for us, a focus on communities, a focus on innovation. People living in crisis are not to be pitied. People living in crisis are not to be looked down upon for their lack of capacity to get out of the crisis. People living in crisis have shown again and again how resilient they are, how innovative they are, and just how resilient they are. What they deserve is our respect, what they deserve is our support, and what they deserve is our investment. We cannot do that without our partners at global, regional, local level. So I ask you today to look at this appeal, to trust that WHO can make a good investment with the funds that are provided, that we can work with our partners at national level, like the good minister from Somalia, my colleague Muhammad Jama on my right-hand side, someone who I've learned more from in the last 30 years than any other human being in public health. So let us look to support those who stand in the front line of the climate crisis, who stand in the front line of the conflict crisis, though they bear no blame as civilians for all that's happening. And let's do our best to collectively, partners in response, both the money and the means and the capabilities that WHO has. We want to be able to leverage them better. We want to be able to leverage them more successfully. And I trust with your investment, we will be able to do so. Thank you.
Thank you very much, Dr. Ryan, for these words and bringing in the importance of partnership and the work on the ground. With that, we'll next hear from three of our colleagues who are working on the ground, those being Dr. Fiona Braca, the Emergency Operations Manager in the African region, the WHO representative in Syria, Dr. Iman Shakeri, and the WHO representative in Ukraine, Dr. Yano Hibbert. So first, may we now invite Dr. Braca to take the floor. Thank you.
WHO Director General, Dr. Tedros, Your Excellencies, distinguished ladies and gentlemen, good afternoon. It is my pleasure to join you this afternoon on behalf of the team at AFRO. The African region faces the highest burden of public health emergencies globally. In 2022, the region accounted for 64% of all the graded emergencies globally. Conflict and climate-driven humanitarian crisis, combined with new and recurrent outbreaks, are creating an increasingly complex public health emergency profile for the region. The increasing human-animal environment interface has resulted in over 60% increase in zoonotic disease outbreaks in the past decade compared to the previous decade. Notably, yellow fever, dengue, Lassa fever, mpox, and viral hemorrhagic fevers such as Ebola and Marburg. Protracted drought and conflict in the Greater Horn of Africa, the Sahel, and northern Ethiopia have resulted in more than 133 million people in need of humanitarian assistance. In the midst of these complexities, we are witnessing some progress by member states in tackling emergencies. For instance, the time taken by countries to detect and interrupt outbreaks is shortening. The investments made to address the COVID-19 pandemic over the past 3 years are paying off, with the region better able to cope with the virus and its health emergency response systems bolstered. With the support of WHO and partners, the investments in intensive care capacity, with 70% of countries in the region now meeting the minimum standard, medical oxygen production, laboratory capacity, among other aspects, are benefiting response to other emergencies beyond COVID-19. However, a lot remains to be done, particularly in the face of emerging complexities and complexities associated with increasing population, migration, urbanization, deforestation, and climate change. Limited health workforce, inadequate financing, health infrastructure, and limited stockpiles of essential supplies remain critical gaps. Through our presence in all countries in the region, WHO is supporting member states to curb disease outbreaks and to meet immediate health needs of people living through crisis, while also simultaneously working to address the systemic inadequacies in the health emergency architecture. In 2022, WHO Afro has deployed more than 800 multidisciplinary experts to support response to major emergencies in countries. We continue to address the needs of essential supplies and equipment at country level, including reinforcement of our logistics hubs at the sub-regional level in Nairobi and Dakar. Thanks to the support from our donors and collaboration with partners, we witnessed disease outbreaks such as the recent Ebola outbreak in Uganda interrupted in 4 months. We need your continued support to address the myriad of emergencies that continue to occur in the region, including the ongoing multi-country cholera outbreak that has already claimed over 900 lives in Malawi alone, far too many deaths. African Ministers of Health in August 2022 endorsed a regional strategy for health security through implementation of 3 flagship initiatives to strengthen member states' capacity to prepare, to detect, and to respond effectively. Health workforce, government leadership, community participation, and sustainable financing are at the heart of these initiatives. WHO Afro remains committed to assist countries to meet the needs of this strategy and to meet the important milestones in the strategy by 2030. Your support is critical to ensure that WHO, together with countries in Africa, are better prepared to tackle and respond to emergencies. Thomas Kiley said, and I quote, "For he who has health has hope, and he who has hope has everything. The hope of many Africans is within our reach. Invest in health and help us make a contribution for a better and a safer world." I thank you.
Thank you very much, Dr. Braca, joining us from the WHO Regional Office for Africa in Brazzaville. We're now going to move from Brazzaville to Damascus, where I have the great pleasure in giving the floor to the WHO representative, Dr. Iman Shakeri.
Thank you so much. Dear WHO DG, Dr. Tedros, Your Excellencies, distinguished guests, ladies and gentlemen, good afternoon to all of you. I would like to start by talking about my recent mission to Aleppo. Despite the city have returned to relative calm more than 4 years ago, it was heartbreaking to witness the lasting destruction of many health facilities, including the 600-bed in Eastern Aleppo Health Complex, along with its state-of-the-art medical equipment. That complex used to host a school, a nursing school, a clinic that provides general and specialist services, as well as 3 specialized hospitals providing ophthalmology, pediatric, and kidney services. During my visit, Ahmad, a man in his 60s, stopped me to share his struggles, trying to earn a living to accommodate the needs of his family, which he can barely meet. His wife, Dima, is suffering from chronic diseases, including diabetes and high blood pressure. He has been unable to provide her with the needed medications. Later, in a hemodialysis center, I met Miriam, a 46-year-old lady who travels more than 50 kilometers twice a week to receive life-saving dialysis sessions. Due to the supply gaps at the hospital, the woman must provide her own consumables for the dialysis sessions on top of the rising costs of transportation. Their stories are increasingly common. The vast majority of the Syrian families are either struggling to provide their basic living essentials or have been unable to do so. Today, in Syria, almost half of the population is in critical need of health assistance. The healthcare system in Syria, which used to be one of the strongest public health systems in the region, has been terribly weakened by the crisis. followed by COVID-19. Only 56% of all public hospitals and health centers are fully functional. 30% of those hospitals lack electric power supply and rely on round-the-clock generators. In some areas, the situation is critical, such as Northeast Syria, where only 1 out of the 16 hospitals is fully functioning, while 8 are partially functioning. These issues are further compounded by chronic shortages of personnel. Almost 50 to 70% of health workforce have migrated. So what does this mean for Syrian women, children, and men? The disruption of basic services, such as water networks and the health system, directly impacts the health and well-being of the population. Most recently, this led to the return of cholera in Syria for the first time since 2009, and resulting in more than 77,000 cases and over 100 deaths. Additionally, the conflict in Syria continues to cause high rates of disability, non-communicable diseases, and mental distress. If disease outbreaks, public health threats, and access barriers are not detected and addressed in a timely manner, we will see an increased morbidity and mortality, especially among the most vulnerable population, including children and the elderly. During the 30-day period in December and January, 26 children under the age of 10 years old died in the Northeast Syria due to influenza. They could have been saved if they have reached care sooner and if properly equipped health facilities were available closer to their homes. WHO will continue to support the health and well-being of Syrians, amongst other things, by providing access to primary health care for more than 2 million people, along with trauma services and access to medications and other supplies critically needed. WHO in Syria will also provide access to much-needed psychosocial services. To deliver this, along with many other interventions, we need around $106 million in 2023. As our DG, Dr. Tedros, continuously reminds us, there cannot be health without peace, and there cannot be peace without health. We have the chance to help Ahmed, Dima, and Miriam to ensure they receive the health services they need and they deserve. It is their right and our obligation to deliver on that. To deliver on health for the Syrian people, we count on your support. Thank you.
Thank you very much, Dr. Shakeri, for these words. We shall now move from Damascus to Kiev, where I have the pleasure in inviting the WHO representative, Dr. Yano Hibbert, to take the floor. Thank you.
Thank you, and I hope you hear well, Your Excellencies, colleagues, friends, everybody who is connected through various channels. Thank you for the opportunity. It's my pleasure to talk to you today as a WHO representative in Ukraine. We are a team of around 200 people working throughout the country in often very challenging and unpredictable circumstances, while also there are many hundreds of WHO colleagues across the world who are supporting Ukraine. And thank you, Tedros, Mike, everybody who are making 24/7 efforts that we are feeling on the ground. The 24th of February 2022 marked the Russian Federation invasion of Ukraine and has brought major challenges to the health system in the country. Since that time, WHO has verified more than 700 attacks on healthcare in Ukraine, which influences the functionality of the facilities, some of them not functional at all, and sadly, also resulting in deaths and injury among the healthcare workers. Attacks against healthcare are a clear violation of international law. Health should not be a target. Furthermore, attacks on critical infrastructure since October 2022 throughout the country means healthcare facilities cannot perform their duties to their people because there might not be electricity, heating, water, and this is a very difficult circumstances. This is the reality, what we face, but at the same time, health system has shown also its resilience. WHO is here to stay, and we continue working with the authorities to ensure that the health system can continue to deliver the services which are so much needed for the people. Since the war began, WHO has delivered more than 2,000 metric tons of supplies. And this means ambulances, medicines, many other things. But let me bring some examples. In April last year, WHO team delivered power generators, oxygen supplies, and others in Irpin and Bucha, and much in the global attention in April. But what was important that with these deliveries, the hospitals were able to continue the care that was not there for almost 2 months. Our teams were able to deliver much needed medical supplies to Kherson in less than 72 hours since the government regained the territories. Very important for civilians who were living there for many, many months without support. And just last week, WHO team, together with the UN, delivered much needed medicines to areas merely a few kilometers away from Soledar that also we all have been following in news. And our colleagues hearing constant shelling, there was no minute without shelling, have delivered those medicines because there are people who need them urgently. This is WHO in action, and this is what the teams are doing across the whole country. And we continue delivering ambulances. We have given over also today essential medicines, trauma and surgery kits, and much more, as long as it is needed. And this is even more critical in the winter time when we see infectious diseases going up, as well many elderly needing support for the chronic diseases. But it's not only supplies. WHO has trained over 10,000 healthcare workers across a range of topics, from public health, mass casualty management, chemical safety, and many other areas. We are supporting Ministry of Health and ensuring that patients who have been injured can be rehabilitated and continue to live in the full scale as much as possible. Our rehabilitation program is active across the whole country and supports also bench trainings for many healthcare workers. And what I have seen, it gives also the moral boost for many Ukrainian healthcare workers when we are along with them treating the patients. The mental health effects of the war cannot be unnoticed. We estimate that every fourth person in Ukraine will suffer the mental health condition as a result of the war. In this regard, we are supporting the Office of the First Lady and the Minister of Health in strengthening provision of mental health services throughout the country, which means also stress management skills improvement to actually providing services with the mobile health and mental health teams. In all this, WHO coordinates activities with nearly 200 partners on the ground through various mechanisms, but also, as Mike said, health cluster. But even the time of war, reforms and recovery can't wait, because people need an environment where to live and think optimistically further. A number of key health sector reforms, from public health to health financing, have also been enhanced in line with WHO recommendations, thanks to our agile approach. The recovery plans are coordinated with authorities, and development partners have come together to think alike. But most importantly, we witness the facilities to be restored. One of those we visited with Tedros back in May has been already restored, and the primary care is available in that center, which got direct hit back in May. To present in the field, WHO has also invested heavily in measures of staff security and well-being, and measures to prevent sexual exploitation and abuse, which now are all in the place across our sites. And we continue. And our priorities are, first, to ensure access to essential healthcare services, particularly in hard-to-reach areas. Second, serve the vulnerable and those with chronic conditions. Third, address current and new public health risks. Fourth, to be rapid and agile in our response as the WHO. Fifth, to be evidence-based. And sixth, bring back stronger health system. Let me end with a few personal reflections. I have repeatedly witnessed firsthand the resilience of health and care workers who continue to deliver healthcare in a very challenging environment. And I have witnessed that in Ukraine. But as colleagues have shared, Ukraine is not alone. And that's why we are looking Ukraine as part of the global appeal. We have seen midwives who are ensuring delivery of newborns in shelters. We see doctors who have performed their duty of care under heavy shelling. Frontline healthcare workers, primary healthcare, emergency care, who are delivering services to people in need and almost 24/7 in very difficult places. My personal thanks, and I think many of our thanks and gratitude goes to them because they are the real heroes. WHO is here to stay and support them and the system because this is what we do. Thank you. Дякую. Гарного дня.
Thank you very much to Dr. Hibbert, the WHO representative in Ukraine. And we're now going to move from Kiev back to Geneva, where I have the great pleasure in inviting our next speaker, Dr. Muhammad Jama, advisor to the Minister of Health of Somalia, seated right next to me.
Thank you very much indeed, Dr. Tedros, Director General of WHO and his senior team. I would like to thank you on behalf of our Minister, Dr. Ali Haji Abu Bakr, for inviting our delegation to be here today, this launch, which is very important for us. It resonates very closely as your contribution saves lives of millions of people every day. In my country and in the Greater Horn of Africa, the drought has replaced millions of people. In Somalia alone, 8 million people have been affected, which is nearly half of the population, of which nearly 2 million people were pushed into internally displaced camps, which has increased the burden of caring so many citizens who are in displaced camps inside the country. Now, Somalia is also suffering multiple health and humanitarian emergencies. There are disease outbreaks going on, and we were responding all those cholera outbreak, measles outbreak, polio, vaccine-derived poliovirus type 2, and other humanitarian emergencies. Our health workforce, despite all the stresses and pressures that are put on their shoulders, were responding at the same time, all these multiple crises, delivering vaccine to the remote areas, despite the security and access issues that our country is facing. Without your support and WHO's real, hands-on support that we are getting inside the country, we would not have been able to do much in, for example, the COVID-19 response. When the COVID-19 hit in Somalia, we did not have diagnostic facilities in the country. We were sending in our neighboring country, the first specimen that we send, sample we send was to our neighboring country in March 2020. Today, we have over 80 facilities that can test and diagnose, and conduct PCR, testing capacity. We have surveillance systems that are being deployed. We have teams that are responding with community leaders and WHO teams who are part. In fact, we do not distinguish them much because they are an integral part of our response and our teams working in the field with all the hazards that we are facing every day. And if you were following the news as late as yesterday, we have one common enemy when it comes to man-made. Of course, climate change is a man-made. And as Dr. Michael Ryan said, it's not something that will happen in the future. It's happening now. It's killing people now. It's displacing, large communities of our population whose way of life in agriculture and in nomadic communities are really seeing, the brunt of climate change, which our contribution, as you know, is not that much. So despite all, these problems, Somalia is making, a huge, significant progress, let me say that. For example, today, during COVID-19, we did not have oxygen plants. We have today over 76, oxygen concentrators that are working, some of them powered by solar energy, and are being innovated across the country, being used. We have also, as our minister was telling today in another meeting, BSA oxygen plants that are producing, oxygen for neighboring districts and are making, an impact to saving lives. So your contribution to this appeal launched by our Director General is really going to save lives. So I appeal on behalf of the communities in the Horn of Africa and the Somali citizens to please be generous enough, because without those support, we would not make any progress in countries like that, and unnecessary lives would be lost. Thank you very much.
Thank you very much, Dr. Jama, joining us on behalf of the Ministry of Health of Somalia. Now I have the pleasure in handing back once again to WHO Director General, to Dr. Tedros Ghebreyesus, for his closing remarks.
Thank you, Fabia. I would like to again thank all partners, donors who have joined today, both in the room and also online. And I would like to thank you for the generous support for the first appeal last year. And we hope you will also extend your generous support this time. I would also like to thank Minister Ali Haji for joining us in person, and his advisor Muhammad Jama, and to Miss Sarah Charles, thank you so much for joining us, and to Dr. Naram Hassan from Iraq, thank you for joining us, and we hope this appeal will be a success and will help us to continue to save lives. And I would like to assure all donors that we, from WHO side, we will do everything we can to help those in need. So thank you so much, and all the best. And Happy New Year. Still we're in January. Okay.